Ladies and gentlemen of the bailiwick and beyond, welcome. Welcome to this broadcast from Beausejour. This is my first appearance as president of this authority, but I am very grateful to have three very familiar faces on the podium with me, and I'll introduce them in a moment. Just before I do that, it would be considerably remiss of me if I didn't pay tribute to the considerable work of my predecessor in relation to the Civil Contingency Authority and generally. He dealt with these matters in an expeditious, efficient and informative manner. And I'm very grateful to Deputy St Pierre for all of his efforts, as I'm sure we all are. Now, we convened this at short notice, but the main thing for people to realise is that there is no reason to panic. There is no reason for the people to be concerned, because the absolute paramount, and I emphasise that word, paramount concern of the people on this podium and those advising us and the other members of the Civil Contingency Authority and the excellent staff that support us is the safety of the people in the bailiwick. That will not change. Nothing is going to change. There's going to be no radical change. Now, there has been a cluster, one cluster, and Dr. Brink will give you the details of that in due course, which is well under control. So everything going forward will be as it is now. There's going to be no opening of our borders. There's going to be no relaxation of our controls. We are dealing with this situation, which has cropped up in the last few days, in the usual efficient manner that Dr. Brink and her colleagues have dealt with it. Nothing is going to change, and we just want to emphasise that, because we know in situations such as these, there is speculation and social media runs rife. There's no need for anybody to be concerned. Now, there has been an outbreak, and I should just announce also that I've just had a conversation with the Deputy Chief Minister. We've spoken to the Chief Minister of the Isle of Man in the last few minutes. They are suspending, and I emphasise the word suspending, the air bridge at the moment. Now, what that will mean is that the people that are currently in the Isle of Man. They do not need to panic. They will come back under the same conditions as they would have come back if the air bridge had continued and not been suspended. So nothing will change in that regard. Now, we're moving into phase 5C, as we know, or stage 5C. That will happen now next Wednesday, and that will progress, albeit just 2 days later than was originally planned, in the way that was previously envisaged. Now, again, as I emphasise, everything is under control. Nobody needs to worry. Matters are being well dealt with. Now, it just shows how efficient we are, because when this horrible pandemic came about and reached these shores in March, although our authorities then and our medical advice and the people that have been assisting us dealt with it splendidly, we're in a much, much, much better place than we were that 7 months or so ago. For example, I'm told by Dr. Brink, and I've got these statistics wrong, she will correct them, that 375 tests were done yesterday. That in relation to that, the situation is well under control, but she will give that information far better and in a more concise manner than me. Now, communication is key. We will disseminate information as soon as we can on a very prompt basis. If anything changes, people will be told. The community will be kept informed at all stages. That will be done quickly and clearly. Now, there are no new measures being introduced at this stage other than Phase 5C, to which I've just referred. We will not be changing anything in the foreseeable future. In a moment, I'll just be introducing the panel, which, as I say, are all well known to everybody in and outside of this room. The first person I'll be introducing is the Deputy Chief Minister, Deputy Heidi Salisbury, who until just a week or so ago was also the Health and Social Care President. Now, she will be on the panel, and she will be on this panel consistently as the CCA, as an advisor, to provide continuity. And it would be contrary to any common sense to lose her expertise and her knowledge and to give continuity to the people of the bailiwick. Now, the person who sits to my left needs absolutely no explanation to anybody. She's probably known throughout the world now, let alone throughout the bailiwick of Guernsey, and that, of course, is Dr. Brink. Now, she will shortly update you on the latest work of the public health to test, track and trace what's happened following the identification of this cluster. Now, Paul Whitfield, the Chief Executive of the States of Guernsey, will go through the details of the move to 5C next week and generally update you in relation to where we are and how this situation has been fast developing and how it is well under control. Now, also in attendance is the new President of Health and Social Care, Deputy Brouard. For the moment, Deputy Barrard, just for this first meeting, will just be an observer, an interested and informed observer, but an observer he will be. He will be going forward an active member of this group and will have an important role to play as we continue to manage the implications of COVID-19. So as I say, and I just give the people of the bailiwick confirmation, nothing will change. There's no need to panic. Everything is well under control. There will be no changes of policy, no changes of the way that we're going to deal with matters. Every new decision will be communicated to the community quickly and clearly, as will any change in circumstances. So, Dr. Brink, if I could ask you to take over, please.
Thank you very much. So, as Deputy Fairbrush said, we are dealing with a cluster of cases, and I think it's really important to define precisely what we are dealing with. So, it's a group of cases. There's certainly been transmission within our community. What we absolutely don't have is widespread community seeding of the virus. So in total in this cluster, we now have 7 definite cases and one presumptive case. 5 of those are linked to a specific venue, and 1 is a family member and 1 is a work colleague. Now, what is really important is that we had the index case who was detected through pre-travel surveillance, and the other cases were all detected through our contact tracing process. And actually, they were all detected before they developed symptoms. Some of them have subsequently gone on to develop symptoms, but at the time we actually detected them and tested them, all were asymptomatic. The relevance of that is after we identified the index case, these people were immediately put into self-isolation, and we tested them when they were in self-isolation. And again, it's that very proactive approach from the test, track and trace program that has always served us so well. What we've also done with this, which differs from what we were doing in March and April, is we've used our expanded testing capacity. Now, we've spoken about that so often at press conferences, how we hugely ramping up our testing capacity. So, for example, we've tested 281 contacts as part of this cluster. Now, had I been in the same situation in March, April, I would have only tested about 1/5 of those. So we've absolutely changed our threshold for testing. So rather than trying to work out who's at most risk and use our scarce testing resources that we had in February, March to target on those, we've simply tested everyone that had even a rather indirect contact. So that's been really important. So this is the first time we've used our enhanced testing capacity, and I'm very pleased with the performance. So in most cases, we're sampling in the morning, testing in the afternoon, and resulting in the evening. So it's back to long days, working to 10, 11 in the evening to ensure that we complete that cycle on a daily basis. Now, one of the questions I think you might rightly ask me is, what is my evidence that we don't have widespread community seeding? Well, if I remind you all that we've always had an expanded symptomatic screening policy. So if you look at the definition that a lot of jurisdictions use, it'll be fever or cough or shortness of breath or loss of sense of smell or taste. We've always looked at a broader case definition that is supported by the analysis of the symptomatology in the first 252 cases that we had. So we use flu-like symptoms, we use sore throat, lethargy, malaise in people that are older. We use atypical symptoms such as not themselves, dementia worsening, loose stools, and so on. So we have a very, very broad testing program. And just by way of an example, since the 21st of September, we've tested 2,271 symptomatic people, and none of those have come up positive. So that just gives you an idea that we've got our broad community testing program, and we haven't had any symptomatic people test positive. So the only people that have tested positive are directly related to that cluster. What I wanted to conclude by saying is that this is a cluster, and we're working around to contain the cluster. We've got people in self-isolation, quite a few people in self-isolation, probably between 80 and 100 related to that cluster. But again, that reflects our very conservative policy. But what I'd like to say, moving into the winter months, I'd really like to remind everyone about the importance of staying healthy this winter. So the importance of hand hygiene. So good hand hygiene. We know that we can kill a lot of respiratory and gastrointestinal bugs by simply washing our hands. But if you don't have if you can't wash your hands, hand sanitizer. Respiratory etiquette, don't leave tissues lying around, get rid of them straight away. Stay at home if you're unwell. But also, as we move into the winter months, is let's look after each other. So, for example, if you have an elderly neighbour who might not be able to go out to the shops or whatever because it's cold or because they're unwell, is help them. So let's have a Guernsey together approach as we move into the winter months. So I think that's really important. And thank you, Deputy Fairbrushe. That's what I've got.
Thank you. Deputy Soldier, anything you want to add?
Thanks, Peter. I'm still here. Some things stopped during the first island-wide election process. The pressures of COVID-19 in the islands didn't. The new presidents and therefore the new CCA members haven't been in their roles for a full week yet, and already we've identified a need for a media briefing. So it's that reason for continuity at a political level. It was thought it would be helpful if I continued on at least for a while, at least until everyone gets their feet under the table. So I'm still here for a little while yet, but we have some very able members of the new CCA, and I'm sure it won't be long before they're all up to speed. And as Nikki has just said, the cases we've identified this week represent a cluster and are linked. Even though we don't know the exact source, we know that the contact tracing process is working, and we're identifying the containing cases. Any cluster of positive cases of an unknown source is going to cause some concern, but we need to make sure we look at this calmly and objectively. As Deputy Fairbrushe has said, this is not March 2020, when we're watching what was going on around the globe and grappling with predictions of an overwhelmed health service and significant fatalities from the virus. We had no on-island testing capacity, and we're reliant on an already stretched laboratory capacity in the UK. Indeed, testing was suspended at one point when we were told no community tests would be accepted because of the UK policy. So we're nowhere near that. 6 months on, we now have an on-island testing capacity of up to 2,000 tests a day. Next week sees new testing facilities become operational at our ports as part of Phase 5C, and something which Paul will update you on shortly. And our processes and procedures to test, trace and quarantine are robust and themselves well tested, as Nikki has just outlined. Now, March saw the introduction of Guernsey Together. And this was a campaign that saw everyone come together in a way many had not ever experienced before. "We've got this" was a phrase that was repeated throughout our community as we worked together to stop the spread of infection. We as a community looked out for each other. People shopped for the elderly and vulnerable. Posties checked on people as they completed their rounds. Nurses came out of retirement to step up and help on the front line. And as we go into winter, we need to reconnect with Guernsey Together ethos. We've been enjoying freedoms that other countries can only dream of, but as I've said before, this is a marathon, not a sprint. Last week, we launched the Guernsey Together winter campaign. I was sat here telling you what it was all about. And it's all about reminding us all of the simple measures we can take to protect ourselves and others. You all know this. You're all great at this earlier in the year, but we may have become a little complacent over recent months with 0 cases and our lives essentially back to normal. Today, my message to you all is simple. If you're ill, please don't go to work. And to managers and bosses, I'm asking that where you can, please support those who are poorly by, where possible, allowing your staff to work from home. We know and understand that this isn't always possible, but if you can, then please do. If you're a business, please keep hand sanitizer at your doors and on your counters. Please regularly wipe down counters and tables. And if you're going into a shop and premises, just don't walk by those hand sanitizers, use them. They're really there for a purpose. And if you can, have the flu vaccination. This year, those who are eligible for free or reduced cost vaccines has been expanded. Check out the information on gov.gg to see if that might be of use to you. And it's good practice to respect personal space where possible, to wash our hands and to stay home if we're feeling ill. The Winter 2020 campaign will be evolving over time. We're looking for champions to work with us to promote the simple messages to protect ourselves this winter. Our first champion will be announced next week. And maybe your office, your class, or your voluntary group could be a champion too. Again, all of this information is online. Get involved if you can. Look after yourselves and look out for each other. Let's not forget who we are and what we're capable of when we work together, when we are Guernsey together. Thank you.
Thank you. Those are excellent words. I'm sure they ring well beyond the bailiwick, and they certainly ring that's the view of us all. Paul.
From me, a little bit more detail. As noted by Deputy Soulsby, next week we move into Phase 5C of our exit from lockdown framework. As discussed at the last COVID panel briefing, even at this testing time, there will always be a requirement for people to travel. And indeed, we would hope the situation improves at some point in the future and more people will be able to travel. The most notable change for this phase is the introduction of testing on arrival at the airport and harbour. In order to make testing on arrival as effective and as efficient as possible, we have developed a new web portal accessed from covid19.gov.gg called the Travel Tracker, which will become available from 8 a.m. Monday the 26th of October for those travelling from Wednesday onwards, from Wednesday the 28th of October. If you are making a booking to travel by air or by sea to the bailiwick, your carrier will remind you to go to the COVID-19 website to provide us with your contact details, travel history, and details of where you'll be self-isolating before you begin your journey. You can fill in the travel tracker 2 calendar days or less before you depart. But if you don't manage to fill it in before you leave, then you will need to complete it on arrival at the harbour or airport. Completing it before you leave will save you time on arrival, but a welcome team will be on hand when you arrive if help is needed. Once you've completed it, the travel tracker will tell you the category of the country or region you are arriving from, which relates to the current prevalence rates in that area. When you arrive, you need to give that information to the staff at the port of arrival, who will direct you to the testing booths. The test is a supervised self-swab, and there will be videos and information at the testing booths to help you through that process. But again, if you're unsure, don't worry, because we have a welcome team who will be on hand to help everybody coming through the ports. If you're arriving from a Category 4 country or region, then you must still continue to isolate for 14 days. But your travel tracker details and your test results will give us the information needed should a track and trace become necessary. The public health team will then be in touch if you're arriving from a Category 3 country or region to arrange your 7-day test. As mentioned by Deputy Furbrush, the Isle of Man have made their own consideration to suspend the air bridge due to our current levels of prevalence. News of this has only been received in the last hour. As noted, we will be looking at the repatriation of returning islanders coming from the Isle of Man and treating them as the Isle of Man is a Category 1 jurisdiction, so they will not face additional restrictions upon their return. We are immediately working with the Isle of Man, passengers and Orkney. The provision for arrivals from a Category 2 country or region continues to be inapplicable at this point, as there are no categories or regions currently classified as Category 2. I must emphasise this will not apply for the foreseeable future due to the high prevalence elsewhere. If for any reason you decide that you don't want to take a test, then you will need to self-isolate for 14 days. Videos and more detailed information about the process will be available online immediately following this briefing. We would like to particularly thank the carriers, Blue Island, Orkney and Condor for their continued support in what is an ever-changing set of circumstances. All details from this briefing are available on the COVID website, and as always, our non-clinical COVID helpline are on hand to answer your questions on 717 118. But I would emphasise again, please, the news around the Isle of Man suspension on Airbridge has only been received in the last hour, and we need to give time for, particularly for Orkney, contact with passengers to work out exactly how that is going to work. Thank you.
Well, thank you all very much to my colleagues on this podium, but I think there are 2 don'ts to consider. Do not be complacent and do not worry. We have the freedoms that have been referred to by my colleague Deputy Salisbury. We want to continue to enjoy those freedoms whereby we can go to restaurants, we can keep our economy open internally, we don't have to social distance, all the things that we have been enjoying over recent months. Those will continue at the present time. There will come a time when we're looking at COVID in our rearview mirror. It's always going to be with us unless medical science is better than even the most optimistic people expect. But we will be able to live with it, but we're not at that stage yet. We've got to get from where we are now to there. We can only do that if we keep ourselves safe, if we keep acting in the community with the community spirit that we've had over the past few months, and I'm sure, knowing the people of Guernsey and the bailiwick, will continue for the foreseeable future. Now's the chance for the media to ask questions. What I'd ask the media to do when they ask a question is, I'll indicate to whoever it might be, stand up, identify themselves so that the people can hear who is asking the question, whether they then think it's a good, bad or indifferent question, and they can carry the responsibility for all that. Now, which of our media would like to ask a question? Mark, if you...
Dr. Brink, just wondering, how reliable are these self-testing kits that you're going to be giving people to use? Have you any indication of whether you get a lot of negative results from them?
So we're not using a home self-testing kit, we're using a supervised self-testing kit, and there's a big difference between giving someone a kit to go and use in their home, whereas people will be taking these samples under supervision. So if there is a concern about the person's ability to take the sample, then what they'll do is they'll be referred up to our testing tent to take the sample. So you might have a slight reduction in sensitivity, but we don't think it'll be significant. And that then is also backed up by an operator-taken swab on day 7.
Yeah, that's something that we've gone through, certainly over the last month, making sure it's the right thing to do. So that has been discussed and gone through in infinite detail, hasn't it, Nikki?
And we made the decision not to just give people a pack to take home to sample. We felt that it needed to be an observed one so that the trained observers at the sampling station will be able to see that people are sampling correctly.
Next question? Yes. And as I say, just identify yourself so people out there can know who you
sure. Ewan Duncan from BBC Guernsey. Question for you, Deputy Salisbury. As someone who's sat on the panel from the very beginning, how unhelpful are the rumours that we've been hearing this week in the community about how many cases we've got and where they've come from?
Oh, clear. It's a really good question, Ewan. They are totally unhelpful. They create panic in the community, and you hear then different stories. As we've always said, don't rely on social media. Just listen to what we say. We will tell you when there is something to tell you, warts and all. I mean, if it's good news, bad news, we will tell. We won't hide things from people. So yes, there've been lots of rumours about it being spread from a ball, which is not true. We know how the cluster is forming and how it's been disseminated. So we'll be open. We've always been open, and really just people, as I say, listen to us and not what somebody who knows somebody says.
Can I just add to what Heidi has said? That's absolutely the question. We will keep you informed. We will keep, well, I'm not just talking about you, Hamish, I'm talking about the more important than the journalists, we'll keep the people of the bailiwick informed. They will know, if necessary on a daily basis. It's important that people do not panic because there's nothing to panic about. It's being well controlled, as you've heard from Dr. Brink. We are eons in front of where we were 7 months ago, and that level of progress will continue.
Absolutely. I mean, and I can say it's not the same feeling that we had back in March when we had no idea what was going to happen and why we went into lockdown. We're not in that position at all.
Can I just add one other comment with regard to rumours on social media? Is when that happens, we have to take one of our members of team simply to field the telephone calls in relation to that. And so it then impedes us doing our other jobs. So it's really important. We've always tried to have an open, honest, transparent communication. We've always said what we know. So what we'd ask people to is to look at the official data coming out. We think that's really important, and it would be really helpful to us as well. So we'd appreciate that.
Yeah, and we didn't when we first mentioned that there were cases earlier in the week, we didn't go immediately to a briefing. I think in some ways that make people panic and to think, oh my goodness, what's going on? We also wanted to get more evidence about what it felt like was happening. And now we've got the evidence, and we were able to impart it to everybody out there.
And that will happen as regularly as is necessary. That doesn't mean, but we won't just convene a meeting for no purpose to say nothing's happened in the last week. because that's a waste of everybody's time. And I'd ask the people out there to bear in mind what Dr. Brink has just said. We don't want a member of her team that could be doing otherwise valuable work having to listen to tittle-tattle on the social media.
Hamish Alscoe, ITV channel. What you say we shouldn't worry, we shouldn't panic. At what point, with the number of cases rising, should we start to worry about a move backwards, back to 5B or earlier?
Well, Dr. Brink will cover it in just a second, but we're a long, long way from that. There's terminology, it's a non-pharmaceutical intervention or whatever that means. That means going backwards and, you know, make it shut in restaurants or whatever. We're a long, long, long way from that. Life will continue as normal. This cluster, because it is a cluster of 7/8 cases at the moment, is well under control. You've heard of the vast amount of work that's been done. And I'd like to say, before I forget, the credit to Dr. Brink and her team and all the other people. They've been working round the clock dealing with this. Isn't it a credit to our small community that we got the kind of the way of life that nowhere else in the Western world has got? Dr. Brink, would you?
I think it is a really good point, a good question. But we've got to have a community expectation that COVID will be around for quite some time, and we will manage COVID cases on Guernsey. That is why we've set up, and we must understand we're supported strongly from the public health team, but this also involves teams across the states of Guernsey, border staff, clinical staff at the borders, border agency staff, right across the communications teams, etc. We do handle this, but I think we mustn't be too alarmed if there's a COVID case or COVID cases on Guernsey. That's why we've applied all these resources, how we've put technical capabilities such as the travel tracker is so we can trace these down, assist the public health team to get on top of this as fast as that we can. So I don't think, you know, we shouldn't be too alarmed when we are managing, because actually part of that is being open and transparent and saying we are managing it.
Yeah,
Sorry, Heidi, you
at
go.
the present moment in time, we know we've got trigger events, and what we will do then, as we say, we're not at that position yet. But then at some point, if things do change, there will be certain interventions that we can do. So, like as Deputy Fairbrass said, it might be some elements of social distancing, but we're not at that position yet. And as Paul just said, you know, we've set up this whole structure to deal with it. So we shouldn't be. This is not like March when we had a case and it spread quickly because we didn't have the team, we didn't have the testing, and we couldn't rely on when we would get any results. So it's a very different situation now.
And just, I was remiss, Paul, you were quite right to gently correct me. All the other people that have been involved, again, you and your team have been absolutely splendid and working around the clock, and all the other people we've mentioned. Dr. Brink.
So I think just to try and answer your question directly, what you asked is what stage would we look at moving back? So if I was sitting here in front of you today with seven definite cases, one presumptive case, from 8 different sources, I'd be having an entirely different conversation and advising Deputy Fairbrass in an entirely different way. What we have is a cluster of cases that are linked together. And I think that is a really important differentiation. So if I remind you about the exit from lockdown framework, we always said that if we had a cluster of cases that we couldn't control or widespread community seeding, those would be 2 things that we would be concerned about. At the moment, we're closing the cluster down. So just for example, the last 2 cases we've diagnosed have had 0 contacts. And that's because we've had them in self-isolation. So we've been proactively following them, and we've been testing them at a set time point before they became symptomatic. Based on the time of their exposure, we calculate what is the earliest time that they would have detectable virus, and we're testing on the basis of that. Now, some of those have gone on to become symptomatic, as I said, but it's a defined cluster that we're controlling. It is not 8 cases that are occurring unrelated around the community. So that then would be a different conversation. So
Nick,
does that answer your question?
Yeah,
Nikki, this is also the case, you could say, because you're testing so many more people. I think you've had over 2,000 cases since, well, the 21st or whatever it is.
2,271.
James, I want to work.
Because of that, you know, you've got there's no evidence at all of community seeding. No. So that, and that's why you feel this is very much contained and just a cluster as opposed to something that gives you wider concern.
And that's really important because those are the symptomatic cases. And if I can remind you of the 3 reasons that we went into lockdown, the one was community seeding, the second was the absence of on-island testing, which we now have, and the third was that we had something bubbling in the community and we couldn't work out what it was because we didn't have that diagnostic capacity. So what I can say today is that over the last month we've tested 2,271 cases that have been symptomatic. With our broader symptomatic criteria, all of those are negative, and we have a testing capacity which we can ramp up and ramp down as we need.
Thank you. Any more questions for the media?
Dr. Brink, are you any closer to actually getting to the source of this outbreak? We know that it's one person, but everyone's obviously curious as to how this one person got it if it had no off-island contacts. So are you still actively pursuing that?
Oh yes, absolutely. So we're looking at a possible source of infection. I think until we've actually defined and are sure at where the infection came from, I think it would be too early to speculate. So that's part of the investigation, but the focus of the investigation is looking at what we've got now and containing what we've got now, because what we want to do is prevent any onward transmission.
Yes, thanks.
There was a tweet yesterday from the States of Guernsey that encouraged people, amongst other things, to respect people's personal space. Could you just explain exactly what that means in practice? And does it mean that people should be careful about going to nightclubs, bars when they're busily next to people, or is that not what that means?
So, no, we aren't asking, we've got no recommendations at the moment for any changes in the broader community. What we're saying, when we say respect people's personal space, is don't go and sit on top of each other. So if you're in a meeting room and you have the ability to space out around the meeting room, do that. It's good practice. I mean, one of the things that you can also consider is alternative greetings over winter. Do you have to shake hands and hug, or can you just give a wave? So hand bump or elbow bump. So we're asking people to consider all of these as alternatives. So look at where you are. Do you have to be on top of someone, or can you be that bit further away? And that is just one of the suite of things that you can do. Hand hygiene, and I know I'm a complete bore about this, but hand hygiene, happy birthday times 2, so important. So, and I've been watching a few people wash their hands, and I think, you haven't sung happy birthday times 2. You definitely haven't, So it's that proper one, both sides, between your fingers. So all of that is really important. And so that forms part of a suite of interventions that we're recommending to keep the island healthy for the winter. And what is really interesting, if you look at the data from Australia, who had COVID at the time of their flu season, is they had fewer flu cases. And they think that was probably related to some of those basic messaging that was going in relation to COVID.
Yeah, and that helps the teams as well if they're not having to deal with people who end up getting flu or other respiratory diseases, having to filter them out. It's so much easier. So yeah, do wash your hands and do use the hand sanitizers that shops put out. I mean, I've been going through shops and seeing people just walk right past, and we've got them at Charles Fossard House, I mean, for a reason there as well. So please use it. But you're doing something for the community.
Yeah, little things, it's like little things. Don't be blasé. We can all forget. And I forgot recently, and I thought, no, I've got to, when you go into a shop, use the sanitizer, etc., etc. It all helps. But again, I emphasise it's well under control, but people must look after themselves so that they can look after other people and respect other people's health and needs. Any other questions from the media? Making sure I haven't missed anybody. No? If there are no other questions, it looks as though we may have, I understand these only take a longer time, but there we go. Oh no, sorry, I shouldn't have provoked a question. But
Sorry, Hamish from ITV again. Today, obviously, Deputy Brouard is not on the panel. Is that going to change going forward, or is there a change of leadership on this briefing?
No, Deputy Brouard will be on the panel, but Deputy Brouard's only been in office a very few days. And what we've had legal advice, and the decision was made by the authority that Deputy Salisbury, because A, she was health president for such a long time, B, she sat through all of these over the last 7 months, will be an advisor, will be in attendance, will be available to us, will have her considerable ability and knowledge available to us for as long as we want it. But of course Deputy Brouard would be fully cognizant of it, but it would be wholly realistic to expect Deputy Broad at 4 or 5 days' notice to suddenly be completely up to speed in a situation such as that. Although I can assure you, knowing Deputy Broad as I have for the last 4.5 years in the States, that he will be up to speed very shortly, and he is a diligent person who will be a full and able and communicative member of this authority. Any other questions? Sorry, I've just... Yep. Well, I was going to do that at the end, Dr. Briggs. I haven't forgotten. I just wanted to make sure the media haven't got any other questions. Yep.
Sorry, finally for me, you say that you want to give time for Deputy Broad to get up to speed. Of course, you're new to the role yourself, a big responsibility for you. Do you feel up to speed and ready to take on this challenge?
Yeah, I do. I'm here. Of course it's important. I do feel entirely happy and cognizant and able to deal with it. But again, it's like everything that I've done in my life, whatever role I've discharged. You surround yourself with able people, as I've got 3 able people on this podium who know more about this matter at the moment than I do. But of course I've assimilated information. I feel totally confident in being able to deal with it.
I think there's also, Deputy Furbush, if my add, whilst we've always thought it was right for the community to have some continuity of faces that are predominantly working with this particular issue, we've also not been scared of bringing other people in when the subject has dictated it. So you've seen the Chief of Police here when we've been talking about pursuance of monitoring and law enforcement. We've had Dr. Raby in early doors when we were talking about the capabilities of the hospital. So we would continue to bring other people onto the panel as and when needed.
Yeah.
And it is about when needed. We're not just have briefings just for the sake of it. Exactly. Clearly there was, say, social media rumours, etc., people concerned. It was absolutely right that we have a briefing now. But we're not in a crisis situation like we were in March. We didn't need to have briefings virtually every other day. This is about having briefings when we absolutely need them, and then having the right people on the panel when we have those briefings.
Yeah, and don't forget also other members of the authority who will be available and will appear as and when necessary are Deputy Prowl and Deputy de Sommeray as presidents of their respective committees. So anybody that we need to assist us and to communicate information will be available. But again, I emphasise the point that Dr. Brink, she could be a deputy, I'm sure, and top the poll and get 24,800 votes, but that Dr. Brink and Deputy Soulsby have made is that Scotch rumour, we will give information. It is of no assistance to the people of Guernsey or the bailiwick of Guernsey at all for people just to speculate. Because that does nobody any good and that creates panic, and there's no need to panic. The matter is well under control.
One more final cherry mark from the press again for Deputy Fairbrush. Do you think the Isle of Man has overreacted by closing the air bridge quite so quickly, and is it going to take another return to zero for them to reopen it again, do you think?
Well, the answer to both those questions, I don't think they've over. I mean, this is a new situation. This has happened very quickly, and as Paul has said, it's been communicated to us in the last hour or so now, because we're 37 minutes into this broadcast. I don't think they've over. I think we may well have taken the same decision if the boot had been on the other foot. But it is a suspension. Howard Quell emphasised to Deputy Soulsby and I, it is a suspension. They want it lifted as soon as possible. He, for example, as a person, said he really enjoyed his visit to Guernsey when he came here and he wants to do it again. And I'm sure he will, and hopefully he spent as much money as he can in the bailiwick. But I don't think it's overreaction. And the second part of your question is that the suspension will be lifted as soon as they feel comfortable. I don't think there's a problem. I don't think that they want this to revert to zero. I can't say for them whether they want it to revert to zero. I very much doubt that they would expect us to go back to no cases before they lift the suspension. Because if you recall, over the past few weeks, we've actually had some cases. There may have been limited numbers, but we've had some cases. We had zero for months, then we had some cases, then we had a day where we had zero again, but sadly that's just gone for the moment. I hope that comes back as soon as possible.
Yeah, and Dr. Brink is in close contact with her counterpart in the Isle of Man, and I'm sure with the evidence that Nikki provides them, they'll be, as soon as they can bring things back, they will do, and it's all about that communication, which has been really helpful over the last few months.
Okay. Now, Christmas is just a couple of months away, and there's the mother said I could mention this young man's name. He's only a young boy, named Flynn, and he's worried about Father Christmas coming here at Christmas. And now we know Father Christmas is magic. I'm hoping he'll bring me lots of presents, and I'm sure you're hoping he'll bring you lots of presents. But Flynn and there's other little boys and girls like him are concerned that Father Christmas might be subject to some restrictions. Dr. Brick's going to deal with that.
So we're delighted to announce today that Father Christmas, Santa Claus, has been given critical worker status. We've been very reassured by the absence of COVID-19 in the North Pole, and so he will be subject to no isolation and no testing requirements, and will be able to visit freely over the Christmas period. And like Deputy Fairbrush, I've had several calls from children who were really worried that Father Christmas, Santa, wouldn't be able to visit this Christmas. So he's free to visit, and we all look forward to him arriving in the bailiwick.
Thank you very much. Are there any other questions as a result of that? Thank you very much. Thank you, my colleagues. And as I say, I just conclude by, as I began, other than mentioning again the good and able work of Deputy St Pierre, but there is no panic, there's no concern, matters are well under control, and we'll communicate fully with you as and when information arises. Thank you very much, everybody.